Hey guys, welcome to my YouTube channel. I am Navya. Now I am going to explain case presentation on peripheral neuropathy. In this video, I am going to discuss about what is peripheral neuropathy and what are the causes, symptoms and treatment of peripheral neuropathy. Before that, we are going to explain about what is peripheral nervous system. The peripheral nervous system refers to the parts of the nervous system that are outside the central nervous system, those outside the brain and spinal cord. Thus, the peripheral nervous system include more than 100 billion nerve cells that run throughout the body. Peripheral nerves, by connecting the spinal cord and brain to all other body organs, transmit motor impulses outward and relay back sensory impulses to encode sensation in the brain. Introduction. Peripheral neuropathy happens when the nerves that are located outside of the brain and spinal cord are damaged. Damage to these nerves interrupt communication between the brain and other parts of the body and can impair muscle movement, prevent normal sensation in the arms and legs. This condition often causes weakness, numbness and pain, usually in the hands and feet. It also can affect other areas and body functions including digestion and urination. Peripheral neuropathy is a disorder affecting motor, sensory or autonomic nerves. Types of peripheral neuropathy. There are many types of peripheral neuropathy: motor neuropathy, sensory neuropathy, autonomic nerve neuropathy, combination neuropathies. We see the etiology: age, genetic condition, diabetes especially in type 2, excessive alcohol drinking for years, idiopathic, low levels of vitamin B12, physical damage to the nerves, an underactive thyroid gland, certain infections, inflammation of the blood vessels, chronic liver disease or chronic kidney disease, the presence of an abnormal protein in the blood, autoimmune conditions, medications and toxins. Now we see about pathophysiology. One of the causes is hyperglycemia, which is a condition characterized by an elevated level of glucose in the blood. Hyperglycemia triggers three major pathways that are oxidative stress, advanced glycation end product, and nerve hypoxia can lead to the production of inflammatory cytokines. Inflammatory cytokines causes neuroinflammation, which is inflammation of the nervous tissue. This is a critical step in the development of neuropathy. Neuroinflammation results in nerve injury characterized by damage to the functions of sensory fibers, changes in ion channels and TRPV1 expression. It can lead to abnormal ectopic discharge, abnormal synaptic neurotransmitter release. It leads to the neuropathic pain. Clinical manifestations that include muscle weakness, change in skin, hair or nails, numbness, loss of sensation, loss of balance, emotional disturbances, dizziness, headache, loss of bladder control, fasciculations, etc. Diagnosis of peripheral neuropathy: skin biopsy, MRI scan, blood test, physical examination, electromyography, and other tests are included. Treatment of peripheral neuropathy. First we see about non-pharmacological: exercise, dietary changes, quitting smoking and alcohol, vitamin supplement and relaxation techniques, and some therapies include scapular therapy, spinal cord stimulation, physical therapy, etc. Pharmacological include pain relievers, anti-seizures medicine, gabapentin, pregabalin, develops to treat epilepsy, often improve nerve pain, topical treatment, antidepressants, plasma exchange steroids and intravenous immunoglobulins. These treatments are often used if inflammation or autoimmune conditions are causing neuropathy. Surgical: neuropathies caused by pressure on nerves, such as from tumors, might require surgery. I am present in the case. Mr. XYZ, a 65 years old male patient, was admitted to the Department of Male Medical Ward. Chief complaint: complaints of tingling and numbness in legs since 2 or 3 months. History of present illness: patient was apparently alright, later had complaints of tingling and numbness in legs since 2 or 3 months. Progressive, aggravated on standing, prolonged walking, complaints of pain radiating from back to along length of right leg, complaints of chest pain in left side, non-radiating on and off, localized by hands, history of past illness, heart diseases, surgeries, PTCA and renal calculi, personal history, tobacco and alcohol use, stopped 3 years back. Physical examination: all parameters are normal except GRBS levels are increased. Provisional diagnosis is peripheral neuropathy. When it comes to lab investigations, CBP, hemoglobin, lymphocytes and PCV are abnormal. In LFT, all parameters are normal. In this, glucose random and HS troponins are abnormal levels, remaining all parameters are normal. In this HbA1c, BSL post-lunch, BSL fasting, these levels are shows abnormal. In this lipid profile, HDL shows abnormal level, 2D echo, normal systolic function, ultrasound scan, minimal hepatomegaly, post-cholecystectomy. Plain MRI study of the lumbosacral spine, diffuse disc bulge L3 to L4, L4 to L5, causing indentation over thecal sac with bilateral neural foramen, narrowing and compression over bilateral existing nerve root. Central or left paracentral disc bulge L5 to S1, causing indentation over thecal sac with bilateral neural foramen, narrowing and compression over bilateral existing nerve roots. Final diagnosis is peripheral neuropathy, de novo diabetes mellitus. When it comes to the day-wise assessment, in the first day all parameters are normal and physician prescribed the drugs include tablet PAN, syrup Talsil Forte, capsule Neuromed PG, tablet Ecosprin Gold, tablet Metexel. Day 2 and day 3 all parameters are normal and continue the same treatment. In day 4 parameters will be normal and continue the same treatment, add tablet Triptomer. In day 5 treatment include whole capsule Neuromed and continue the same treatment, add some of the drugs tablet Fexon, tablet Gabapin NT, tablet MB Active. In day 6 whole tablet Triptomer and continue the same treatment, add tablet Dapamac and tablet Diter+. In day 7 continue the same treatment. Physician medication chart. Drug tablet PAN, generic name is pantoprazole, route of administration per oral, dose and frequency 40 mg once a day. Therapeutic use treat gastric acidity, duration day 1 to day 7. Syrup Talsil Forte, generic name is hydrotalcite plus simethicone, per oral 5 ml thrice a day, treat acid reflux, duration day 1 to day 7. Capsule Neuromed PG, generic name is pregabalin, methylcobalamin, route of administration per oral. Therapeutic uses treat chronic pain caused by nerve damage, duration day 1 to day 4. Tablet Ecosprin Gold, generic name is atorvastatin, clopidogrel plus aspirin, per oral, prevent heart attack and strokes, day 1 to day 7. Tablet Metexel, generic name is metoprolol succinate, route of administration per oral, 12.5 mg once a day. Therapeutic uses prevent hypertension, duration day 1 to day 7. Tablet Triptomer, generic name is amitriptyline, per oral, dose 10 mg, frequency at night time, treat depression and neuropathic pain, duration day 4 to day 5. Next, tablet Flexon MR, generic name is ibuprofen and paracetamol plus chlorjoxazone, per oral, twice a day, relieving muscle pain, duration day 5 to day 7. Tablet Gabapin NT, generic name is gabapentin plus nortriptyline, per oral, at night time, treat neuropathic pain, duration day 5 to day 7. Tablet MB Active, given in per oral, once a day, supports cerebral circulation and cognitive processes, duration day 5 to day 7. Tablet Dapamac, generic name is dapagliflozin, per oral 10 mg once a day, treat diabetes and prevent heart diseases, duration day 6 to day 7. Tablet Diter+, generic name is torsemide and spironolactone, per oral once a day, reduce fluid accumulation in body, duration day 6 to day 7. When it comes to the SWOP analysis, subjective data, a 65 years male patient was admitted to the Department of Maid Medical Ward with complaints of tingling and numbness in legs since 2 or 3 months. History of present illness. Patient was apparently alright, later had complaints of tingling and numbness, progressive, aggravated and standing, prolonged walking, complaints of pain radiating from back to along length of right leg, chest pain, heart diseases, surgery of PTCA and renal calculi, tobacco and alcohol use stopped 3 years back. Objective data abnormal in hemoglobin, glucose random, HS troponin 1, HbA1c, postprandial blood sugar, HDL cholesterol, MRI, BSL fasting, ultrasound scan. Assessment based on subjective data, tingling and numbness in legs, progressive, aggravated and standing, prolonged walking, pain radiating from back to along length of right leg, chest pain in left side, heart diseases, surgery of PTC and renal calculi, tobacco and alcohol use stopped 3 years back. Based on objective data, hemoglobin, lymphocytes, glucose random, HS troponin, HbA1c, estimated average glucose, postprandial blood sugar, HDL cholesterol, MRI, ultrasound scan clearly shows peripheral neuropathy, diagnosed as peripheral neuropathy and de novo diabetes mellitus. Plan. Based on subjective and objective data, the patient was diagnosed and the physician prescribed the drugs to treat these conditions. Drug interactions, there is no drug-drug interactions. Drug-disease interactions, tryptomer plus cardiovascular disease. It leads to increase the side effects of heart diseases. Drug-food interactions are avoid consuming foods rich in sugar while taking Dapamic, as it may spike the levels of sugar in blood and cause low blood sugar levels. Drug interventions, there are certain drastic side effects, hence the patient should monitor his or her body and its activity. Tryptomer plus cardiovascular disease, the drug should not be administered. The patient is having heart diseases. Patient counseling, take medications regularly on time. Take green and leafy vegetables, broccoli, spinach and asparagus. All contain vitamin B, a nutrient important for nerve regeneration and nerve functions. Diet rich in fish, nuts and whole grains, etc. Avoid repetitive weight-bearing exercises such as jogging, prolonged walking and step aerobic. Manage blood sugar levels. Follow a healthy diet. Exercise and try physical therapy. Reduce exposure to toxins and quiet smoking and alcohol. Manage stress. Regularly check skin and feet. Protect from heat and cold. Try to keep regular appointment with doctor. Thank you guys. I hope you like this video.